I can see your screen properly, that's all.
Okay. We'll go live in a minute.
Okay. Do you want me to send you the other script?
Which one? The 10-minute one?
Yeah,
Yeah, send it.
hold on. Are you able to hear the voice talking?
Yeah.
Guys, no talking at all. Huh? Today's topic is
Today is urology.
okay.
I've sent you the link. We are live now.
Okay, hold on. Hi guys, everyone. We'll be starting the quiz at 10:10 p.m. Okay? Guys, to join the quiz, kindly scan the QR code or go to AHA slides and enter this code ICG82. Guys, this quiz will start at 10:10 p.m. You can join the quiz by scanning the QR code.
Or if you guys are in the Telegram, you can directly click the link which we have sent it. We'll start the quiz at 10:10, guys. So please wait till then. Let your friends also join.
Guys, till the time we start the quiz, that's 10:10 p.m. Do let us know your feedback. We would love to hear from your side. And what do you want next? What are your subjects that you want to get the quiz on? So, guys, welcome to JuxtaMed Quiz Show. Tonight, we are diving deep into the fascinating world of medical knowledge, where myth meets wisdom. For those of you joining us for the first time, this is the ultimate platform to challenge your mind, learn something new, and have a good laugh along the way.
Before we dive in, let's give a quick shout out to our socials. Please follow us on Instagram, Twitter, Facebook at JuxtaMed Quiz Show as the username for all the exclusive updates, behind the scene fun, and more challenging quizzes. And also, don't forget to tag us in your post. You might get a chance or a special mention in tomorrow's session.
Yes, guys. And as a disclaimer, I would like to let you know for tonight's quiz show and the upcoming quiz shows as well, we do not have any negative marking. It is not like a NEET PG exam. It is your JuxtaMed tuning at every 10 p.m. every day. So remember, there is no negative marking. Just put your answer, whatever you think right, you'll know it if it is right or wrong.
Yeah,
We'll be
there's no
starting the
negative
quiz.
marking,
Yeah.
but the timer is set to 30 seconds. Sorry, it's 35 seconds.
To add on to the part, it is the fastest fingers first. So you have to be first and you have to have your answers accurate as well.
So the people watching us on YouTube live stream, you can also join the quiz by using the link which is on the left-hand side of your screen. That is ahaslides.com/ICGA2. Or you can scan the QR code directly.
Guys, the quiz will start at exactly 10:10 p.m. Okay? So buckle up. Hope you have been prepared well. Let's see how do you do. And if you do good here, most probably the chances are that you're going to do great in your NEET PG exam. So buckle up.
Okay, 2 more minutes, we'll start the quiz.
Guys, last minute to go. All right, guys. So it's 10:10 p.m. I hope everyone's ready because we're starting with the quiz. Okay. Should we, Dr. Manoj?
Yeah, we'll start.
All right, guys. So welcome to another exciting episode of JuxtaMed Quiz. Today, the quiz is on urology, and we have 10 questions lined up to revise the topic. Let's see how well our audience do with this. Let's start. The first question.
Yeah.
A 30-year-old male presents with recurrent UTI and abdominal discomfort. USG reveals a midline mass, and a further imaging shows that both kidneys are fused at their lower poles, forming a U-shaped structure anterior to the aorta at the level of L3. What is the most likely diagnosis? You can see in the
To give a
image.
clue, this is a rare,
Yeah.
yeah, it's a rare congenital condition. Yeah, most of them got it right.
Hey, that's a goodie. Yeah. So let's see the leaderboard.
Okay, we have Karthikeyan, followed by RDT, CK, Krishna, Kanye, I think I knew this. Okay. Urvashi, then Naga, Myra, Manu, then Hemant, Mahesh, Harsha. Good going, guys. Let's move on to the second one. What is the primary use of DMSA scan? That is dimer captosuccinic acid scan in clinical practice. To give a clue, it's not just for looking at the kidneys. This scan can be very useful where there is concern about renal scarring, particularly in younger patients with UTI.
Yes, guys. Let's see how you have done.
Okay, I think 24 of them have chosen renal perfusion and drainage, but it was actually anatomical details of the kidney because we can see scarring also here, the extent of scarring. Okay, we have Reddy now in the first place. Then second place we have Soumya and also Rakshaya. Then fourth place we have Urvashi and Karthi. Then sixth place we have Vishnupriya. So let's move on to the third question. A young male presents with dull aching pain in the left scrotum, which worsens on standing and improves when lying down. On physical examination, the scrotum shows a bag of worms appearance. I think this is a classic sign. So, what will be your most likely diagnosis? To give a clue, this condition is commonly found in young males and is associated with venous dilatation. It's often painful but can cause discomfort, especially while standing. Yeah, it's very cozy. Okay, guys, let's see the leaderboard. Okay, it's Reddy leading now, followed by Urvashi, Soumya, Vishnupriya, then Karthi, Rakshaya, Navi, Chiru, then Dr. Pri, then Keith, Karthikeyan, CK, RTT, Krishna, Manu, Kanya, L, Myra, Hemant, Mahesh. Good going, guys. Good going. So let's move to the next one. Okay. A 16-year-old male presents to the ER with sudden onset severe left scrotal pain and nausea. So elevation of the scrotum reveals relieves the pain. So what is the first thing you do? Sorry, where was I? Sorry for it. Elevation of the scrotum relieves the pain. So what will be your diagnosis? So very important line to note is elevation of the scrotum relieves the pain. So from that point, you'll get the answer, I guess. Let's see. Yeah, it was actually epididymo orchitis because the pain is relieved when the scrotum is elevated. In case the pain was not relieved on elevation, it is seen in testicular torsion. Yeah, 24 of them got it right. Okay, we have first place, we have Soumya. Second place, we have Urvashi. Then third place, we have Rakshya. Fourth place, we have Karthi. Then Navi, Hero. Good going, guys. Let's move on to the fifth one. A 30-year-old male presents with blood at the urethral meatus, inability to void, and perineal swelling, followed by a blunt pelvic injury. So, what is the most appropriate initial management step? To give a clue, I think it's important to remember that this injury can be dangerous for the urethra. Don't just jump into catheterization. There's a safer way also to manage this trauma initially. Yeah, it is retrograde urethrogram to assess the extent of injury. Okay, I think today leaderboard is changing very frequently. Okay, the first place we have Dr. Urvashi. In second place, we have Dr. Karthi. Then third place, Dr. Soumya, followed by Dr. Krishna, Dr. Reddy, Dr. Akshaya, then Dr. Supriya. Then we have Dr. RDT, Dr. Vishnupriya, Keith, Ray, Naga. Good going, guys. Good going. So let's move on to the sixth one. The 65-year-old male presents with complaints of increasing difficulty initiating urination, weak urinary stream, and frequent prostate is enlarged on digital rectal exam, and the post-voidal residual urine is also elevated. What is the most likely diagnosis? Also, guys, people watching us on YouTube Live, can you tell what is the post-voidal urine volume which we take as the cutoff for diagnosing BPH?
Right. Let's see what they got.
Yeah.
Nice. So most of them, I mean, every one of them have got this right. So you're going great. So moving on to the leaderboard, we have Urvashi standing with the longest streak, followed by Karti, then Krishna, and then Soumya. So guys, you're doing great. Let's move on to your next question. Yeah. A middle-aged man presents to ER with painful hematuria and an inability to void following blunt trauma to the lower abdomen. A Foley's catheter is inserted, but no urine returns. A retrograde urethrogram reveals a bulbar urethral injury. What is the next step of management? What do you do, guys? What do you do?
Yeah, it's correct. It's suprapubic catheterization. Good, guys. This
Nice.
was a PYQ. Okay, we have Urvashi, Krishna, Reddy in the top three places. Then we have Naga, Navi, RTT, Keith, Vishnupriya, Karti, Supriya, Toast, AG. What is it? The antibody? No, antigen, sorry. Okay, good going, guys. Let's move on to the next one. Eighth question. A child has a history of difficulty with urination, but otherwise no associated symptoms. The physical exam reveals a curved penis with a meatus located along the underside, so just which is just proximal to the glans. What is the most likely diagnosis?
Let's see if I give you a clue. What do you say? This is a congenital anomaly where the meatus is located on the underside of the penis. It's often noticed in young children and can be associated with a curvature of the penis. Let's see what you get.
Yeah, 36 of them got it right. Epispadiasis is the. Where is it, guys? Can you give us the answer? And what is paraphimosis as well? It will be a good revision.
Nice, guys. You're doing great. Let's keep up the pace. There's no much changes in the leaderboard. Moving on to your next question. A 25-year-old male presents with a painless, firm, non-transluminating mass in the right testicle. He reports no gradual history of trauma but has noticed gradual swelling over the past few weeks. Ultrasound confirms a solid testicular mass. Serum marker reveals elevated AFP and HCG.
This is the classical, guys. I think many a times you have revised in patho as well. Yeah,
That's
it's
right. That's
seminoma.
bravo.
So,
Bravo.
yeah, let's see the leaderboard. Here we have Urvashi in the first place. Then in the second place, we have Krishna. Third place, Reddy. Then followed by RTT, Ravi, Karthi, TK, Supriya, Vishnupriya, and AG. Okay, good going, guys. So we'll move on to the last question.
All right, guys. The last question of this quiz is going to be in front of your screen. Let's go.
Yeah, 40-year-old male presents with intermittent flank pain and mild hematuria for few months and no fever. A non-contrast CT scan reveals dilatation of the renal pelvis and calyces with thinning of the renal cortex in the left kidney. So, what will be the most likely cause for this patient's symptoms? Sorry.
All right, guys. To give
One
you a
clue is
clue,
there is no fever. Yeah.
yeah. So this condition often involves an obstruction leading to fluid buildup and kidney damage. The scan shows characteristic findings of the hydronephrosis, but the cause is the key. I hope you know the key.
Yeah. For 9 of you who have chose pyelonephritis, I think you guys missed. There was no fever in the question.
Hmm. Key details, guys. Key details. Wow,
Okay,
the
we have Dr.
tables.
Krishna as the
Yeah.
winner.
Congratulations, Dr. Krishna. You have been a hoot, having a longest streak. Oh no, it's Keith. But Krishna, you have won the game.
Yeah. And congrats to Urvashi and Aditya as well.
Yes. Congratulations to all of you as you come over here and you give this quiz, you validate yourself as well. So you're doing great.
Yeah.
So that's a wrap for today's quiz, guys. Today's JuxtaMed Urology quiz.
So stay tuned for more quizzes like these.
Every night at 10 p.m. You've been a hoot and you've been a great audience as well. Thank you for joining us and keep learning and keep sharpening your knowledge.
Yeah. We'll see you in the next quiz, guys.
Right.